Good evening. They say emergencies do happen when we least expect them. One of the major emergencies that you would encounter in your entire life would be cardiac arrest. Cardiac arrests may happen anytime, anywhere. Without prior warning, all of a sudden, someone will collapse. Actually, 70 to 80% of cardiac arrests would happen away from hospitals, not within hospital care settings, with very minimal survival rate, talking about only 10 to 11%, which means almost 90% of cardiac arrests that happens away from hospitals, they end up dying. Well, this is a huge number of patients to end up dying. Why would this huge number of patients end up dying out of cardiac arrest outside hospitals? Very simple. Most of them, they go arrested unwitnessed. Very few of them would be witnessed by their families, their friends, their colleagues, or sometimes bystanders. And you would imagine what would be the reaction of a family, friends, colleagues, or even bystanders when they encounter someone collapsing right in front of their eyes. How they are going to react? Most of the times they are going to panic. They freak out, start screaming, crying. Now, until they realize that this is real emergency, they need to immediately activate emergency response system. And unfortunately, many people, they don't know the number. The number in Saudi Arabia would be 997 or 911. And even if you call and they manage to call 997 or 911, do you think they would arrive very soon? They will take time. These patients, most of the times, they are unresponsive, they are not breathing. It would be difficult for a bystander to check if this patient is having pulse or not. If this patient is not responsive and he is not breathing, he is in cardiac arrest. And definitely he needs CPR right away. Unfortunately, the percentage of non-healthcare professionals who knows how to do CPR is very insignificant, talking about less than 1%. Which means these patients, okay, they don't have any chance. Always remember, if a bystander knows how to do CPR and he initiates CPR right away, this always doubles or triples chances of survival. That's why learning how to provide basic life support to anyone who goes into cardiac arrest in the pre-hospital care setting is the key for saving lives. Remember the chain of survival. Starts early recognition of emergency, early activation of CPR, and early activation of EMS, and early initiation of CPR. So this is the chain of survival. Be there when an emergency happens, manage to call 911 or 997, and start CPR. There is also a big issue here. Many patients who goes into cardiac arrest, they may have slides into some kind of arrhythmia, like ventricular fibrillation or pulses ventricular tachycardia. And these are what we call the two shock arrhythms, which means that this patient needs an immediate shock. Shock means a defibrillator. And usually these defibrillators are available with paramedics or in the hospitals. That's why they invented what they call the emergency, the AED or the automated external defibrillators, hoping that these AEDs are available everywhere. Unfortunately, till now, you don't find AEDs everywhere. Hopefully, in the very near future, there will be an AED everywhere, and people should be able to use AEDs as soon as it's available.